friends, how are you today? I am back, Dr. Sonal Parihar, on your own YouTube channel, Ask Your Gynecologist. So what is the topic that I have come with today? It is on your own request, that is PMS, Premenstrual Syndrome. Now what does that mean? It means the emotional and the physical symptoms that a lady, a woman goes through a few days before her periods, generally 10 to 15 days before her periods. Now why is this so important? It is important because the stress level, the anxiety level, because of the lifestyle has actually increased. So that is why PMS has actually increased. And for this, the ladies, the girls, the women, they are actually consulting doctors and they really need treatment for that. Now how common is PMS? I would say 80% of the ladies will have some symptoms before they get their periods, but around 20 to 30% actually suffer from PMS, that is Premenstrual Syndrome. Now what are the symptoms of PMS? Coming to the physical symptoms, the lady will feel that she is getting fat, she will have a bloating sensation, she will feel as if her bangles are getting tighter, her clothes are getting tighter, she's having heaviness and tingleness in the breasts, her rings in the fingers are getting tighter, then she will have mood swings. These are the emotional symptoms we're talking about: mood swings, irritability, don't feel like doing anything, anxiety, then sleeping problems, sleeping disorders, I couldn't sleep. Then what are the other symptoms she can suffer from? Sometimes she can have problems with the constipation and diarrhea, like gut problems, digestion problems, excessive tiredness. Then sometimes they can even develop acne, means like pimples all over the face or even on the forehead, and they generally disappear when the menses starts. So these are certain emotional and physical symptoms which can actually become very severe and can actually disturb the day-to-day life, and then it is termed as PMS. Now if you look at the menstrual cycle, as is there in the graph, there are two phases of menstrual cycle. One is the follicular phase, which is before the ovulation, and the other is the luteal phase, which comes after the ovulation. So broadly speaking, it is 14 days before and 14 days after. PMS, premenstrual syndrome, is always in the luteal phase. That is in the second half after ovulation, and generally disappears with the onset of menses, and it is absent in the first phase, that is follicular phase. So that is how we diagnose it. So actually when you come to the doctor, there are no specific tests how we can diagnose PMS, but then we have to rule out the other problems. Like there are many other diseases which can mimic, which can have common symptoms like PMS, like anemia, like thyroid disorders, like irritable bowel syndrome, that is IBS, then migraines, again present with headaches and nausea, then actual depressive symptoms, actual depression, in which the patient will need a psychotherapist or a psychiatrist. In that case, we need to rule out it is not just depression, it is only PMS. Then sometimes there are certain diseases pertaining to the uterus, like endometriosis, which can cause severe pain, pelvic congestion syndrome. All these diseases of the uterus can actually mimic PMS because it causes a lot of bloating and pain just before the period starts. Sometimes even asthma or any chronic disorder which the patient is suffering from can mimic like PMS. Now, who are the ladies who are actually prone to PMS? The ladies who are between the age group of 20 to 40, the ladies who have lots of stress in their personal life, generally ladies who have children, at least one child, because then the duties, then their social responsibilities are more, obviously they are more under stress, or students who are having lots like exams, they're going through exams and lots of tension in the colleges. So these girls who are actually going through lots of stress in their life and anxiety in their life are more prone, or the women who already have a history in the past of depression, either because of some personal reasons or because after delivery there is a hormonal imbalance and they've already gone through that treatment. These ladies are more prone to PMS. Even certain vitamin deficiencies like vitamin D deficiency, vitamin B12 deficiency, anemia, they can actually reduce the immunity of the body and they can have PMS, that is intolerance to these symptoms. What actually causes PMS? Now, it is actually a hormonal imbalance. I would not say imbalance, it is the fluctuation in the body which every woman goes through, but only 20 to 30% actually suffer from PMS. Now, I have already told you who are the ladies who are prone to these symptoms. Causes are actually the fluctuations in the two hormones, estrogen and progesterone, and there is another hormone called serotonin. So as you can see in the graph, it is in the later phase, the second phase, that progesterone rises. Progesterone is a hormone which causes lots of water retention in the body, and actually there may be a little bit of weight gain, like 1 or 2 kgs just in the premenstrual period because of the water retention. That is why the rings get tighter, the bangles get tighter. So it is because of this hormone. These are physical and emotional changes they occur, and the ladies who are more prone, they get these symptoms. Serotonin is a hormone which gets secreted from the brain wherever there is depression, and it can lead to bulimia, like eating disorders, and it causes a lot of depression and mood changes. So how do we treat it? Now, the treatment depends upon the patient because she has to change her lifestyle. First of all, reduce stress in your life. Just mark out, just see what is actually troubling you and try to deviate yourself from that. Try to divert yourself from that particular stress. Have a healthy eating habit. Stay away from caffeine, alcohol, and nicotine, and stick to a healthy balanced diet which contains calcium, magnesium, curd, there's yogurt, then vitamin D, vitamin B12, folic acid. These are the things which are routinely present in a healthy diet. So try to get at least 8 hours of sleep. That reduces stress. Get up slightly early. Exercise in fresh air. If not possible, then you can go for a morning walk. So that will actually reduce the stress level. Have a balanced diet, and then sleep well. Most important thing, have lots of clear fluids because they will increase your digestion, that is improve your digestion. They will help you fight constipation, diarrhea as well as bloating, and give you a very healthy feeling. Coming to medicinal treatment, depends what you are suffering from. If a lady has lots of headaches, she can take some analgesics, that is painkillers, of course advised by the doctor. Brufens, other NSAIDs, naproxens, these are all good. Then sometimes the bloating might be so severe that she might need a diuretic. Now diuretic are drugs like, for example, spironolactone. These are the drugs which act on the kidney and increase the formation of urine. So whatever fluid you are retaining in the body comes out through the urine, and that gives you a better feeling. Sometimes OCPs, that is birth control pills, are also given. What do? The hormonal fluctuations within the body because of the menstrual cycle, they get reduced or negligible because of external hormones. So when we give external hormones in the form of pills, then these internal fluctuations are gone, so the symptoms of migraine, that is PMS, are gone. Some ladies might need some calcium, vitamin D and vitamin B12 supplementation. That depends upon your doctor. She will investigate you, and then we'll go from there. Sometimes if the severity is too much, then the doctor will actually refer you to a psychotherapist, and you might need SSRIs, that is antidepressant drugs. So we can easily fight PMS symptoms if we are well aware of what causes it, and we can bring about a change in our lifestyle. So I think that's it for today. One more thing I would like to add, PMS normally disappears around the perimenopausal period. Perimenopausal period is the period which is like 5 to 6 years before menopause. It is that time of life where the ovulation kind of stops inside the body, and the cycles, the menstrual cycles that a lady has are generally anovulatory. There is no ovulation, so the major fluctuations in the estrogen and progesterone, they are gone. So that reduces the PMS. So ideally it should be between 20 to 40 of age group, as we have already discussed. So I think that's it for today. I'll stop here, and if you have any queries, you can always put in the comment box. If you have not understood something, I can always answer it back, or you can follow me on my Instagram handle sonal.parihar.33. So bye for now, take care. I'll be back with a new topic. Thank you, bye.